Welcome to the training module for toilet training specific to children with special needs. The agenda for this training module would be covering how to structure the toilet for your child with regards to the placement and the actual washroom setting. It would also be further dealing with understanding habit formation, how children communicate their needs for toilet training, sensory issues that may be impacting the child while using the toilet, as well as diet and physiological areas. Furthermore, various practical activities and strategies would be highlighted which you could use with the child, whether at home or at therapy settings. Case studies and research findings would further help you understand how children face issues with toilet training and how best to help them. The visuals that you would see on the screen would help you understand how to structure the toilet for your child. With regards to children with special needs, do ensure that you do provide seats with support if the child is young. Doing so helps provide the child with balance and support, which helps the child feel comfortable while using the toilet. Children with cerebral palsy would also require seats with support, and it is important to ensure that the toilet is arranged in a manner which helps the child with their particular need. Placement of paper or water next to the seat is also important to help the child understand when they might need to use these in order to clean themselves up once they have finished using the toilet. The placement of the sink, as well as maybe perhaps a stool to help the child keep their feet while sitting on the seat, is also important while we structure the toilet. Various points which we must consider before getting started with the actual toilet training is to address the child's medical concerns and to be aware whether the child suffers with any particular medical condition which could hamper the toilet training activity. A checklist for toileting skills that your child already has is extremely important as it helps you to understand what are the areas that your child is already familiar with and which are the areas that you would be required to now work with. You could create a toileting pattern using the elimination patterns and a daily intake form which are included in the module as you go on. Focus on the child's communication to understand how much the child is able to convey their need for toilet training and to use the toilet. Also focus on the child's sensory needs to understand what are the various sensory issues that the child may be having which may interfere or hamper the toileting activity, and thus you could structure your activities better. Before we begin with the actual activities and strategies, we must understand what are the signs that various children with special needs display or exhibit to understand what is their readiness for the toilet training. For children with autism spectrum disorder, being able to tell you through a sign or a gesture is one such symptom. Being able to follow simple instructions like sit on the toilet and being able to pull his or her pants up and down is another sign that they are ready for toilet training. Furthermore, having regular formed bowel movements and enough bladder control to stay dry for at least 1 hour at a time during the day is another sign. For children with cerebral palsy, you must be able to answer these questions before you begin with toilet training to understand the readiness for the child. Can your child stay dry for at least few hours at a time? Does your child get uncomfortable when his or her diaper is wet? Can your child discern the difference between being wet and dry? Does your child seem interested in using the potty? Signs of intellectual and psychological readiness include the ability to follow simple instructions and cooperation by the child. Another sign could be being uncomfortable with dirty diapers and wanting them to be changed. Recognizing when he or she has a full bladder or needs to have a bowel movement is another sign to look out for your child. Also, whether the child is able to tell you when he or she needs to urinate or have a bowel movement. It is also important to ensure if you can note whether the child is able to ask you to use the potty chair or ask to wear regular underwear. Signs of physical readiness include if the child is able to tell you when he or she is about to urinate or have a bowel movement through his or her facial expressions, posture, or by the words that he or she may use. Another sign could be whether the child can stay dry for at least 2 hours at a time and whether he or she is able to have regular bowel movements. It is also helpful if he or she can at least partially dress and undress himself. The concerns for children with developmental disorders for toilet training include First and foremost, the parents and caregivers of children with these delays cannot rely on the typical timelines for guidance about toilet training. Due to the delays that the child has, they instead must continue to watch for signs of readiness even after the toddler years when training usually begins. Secondly, children with delays often have difficulties with language, both in understanding spoken directions and in verbally expressing their toileting needs. Third, because some children have difficulty with a change in their routine, they may be resistant to the steps involved in toilet training, such as taking away the diapers or sitting on the toilet for several minutes. Fourth, they may also have a high activity level. They may be anxious in new situations, have difficulty feeling when they need to go, or have sensory sensitivities. For example, they may overreact to the loud sound of flushing, the sight of fluorescent lights, the feel of the toilet seat, or the smell that could be associated with the bathroom. We must first assess the readiness of the child for toilet training. First, observe whether the child acts differently or seems to notice when diapers or clothing are wet. You could note whether these are explained or expressed through a verbal mode or through facial expressions by the child. Second, is there any alteration in behavior or interest observed related to bathroom, toilet, hand washing, dressing, undressing, or other related tasks? Third, whether the child shows interest or behaves differently in response to seeing other people engaged in any activities or objects related to toileting. Fourth, keep a check on whether the child is able to sit and hold himself in basically an upright position. You could develop a toileting schedule by making sure that the child follows a visual schedule which you set for eating food and drinking fluids during the toilet training in order to enhance regular elimination. You should regularly observe appropriate times for toileting and include those times in the schedule for predictable elimination. A sample of a chart which you could make in order to write down the time is visible on your screen. This would help you to record when he or she wets himself or herself daily for a period of 1 week. You could refer to the sample chart to understand how to record the time the child uses the washroom for potty or for urine. It is essential to teach toilet training to children as it is one of the first things a child learns to communicate about. Inadequate toilet training would result in significant amount of time and energy being used, and poor toilet hygiene can also interfere with social acceptance. It is important to help the child build their self-confidence and to feel self-assured about being in control. The training module would be focusing on 4 aspects of toilet training. 1. Being habit formation, which would help us to understand why the child has a resistance to change. Second, sensory issues such as auditory overload through the flushing sound, vestibular imbalance, and decreased body awareness. Third, diet and physiological areas such as improper diet, bladder and bowel control, and sitting on the seat. And fourth, communication of needs, that is, whether the child has trouble indicating when to use the toilet. The Structuring Routine resource by NerdNerdy helps familiarize the child with understanding the sequence of activities to be carried out in the washroom or in any other situation. For toilet training, you can make use of the picture cards as is shown in the video, and you can take these one by one to help the child understand what comes next. Once completed, each task can be moved to the finish basket, and only then can you relate this in the actual washroom scenario. Before you begin with the toilet training activities for the child, it is first important to ensure that you structure the toilet as per the child's need. You must ensure that the toilet seat is adequate as per the child's height. If not, you can see that there is a stool that you can place in the washroom so that the child can keep his or her feet on that stool and be able to maintain balance while seated. This helps the child to feel comfortable and secure and reduces the fear of falling or losing balance. In the next visual, you would see that there are certain cards that have been placed in a sequence for the hand washing activity. By having visual cue cards and picture cards, the child is better able to understand what needs to be carried out step by step. You can place these on the Velcro board and stick these cards in the sequence that you wish the child should carry out the activity. With each activity that the child completes, you can remove the picture card so that the child understands what comes next in this sequence. Similarly, you can also have a board placed, as you can see in the video, which has the picture cards for the activity regarding the use of the toilet. These can also be stuck on and removed one by one as the child completes the activity. It also provides the child a visual cue to understand what is he supposed to do by looking at the picture cards. As you can see, the cards depict pulling down the pants, putting the feet up on the stool, using the washroom, pulling the pants up after standing, flushing, and hand washing. The potty training schedule chart, which you see in the video, is where you can stick these picture cards one by one to be able to understand the activities that the child has completed. This is more for the child than the parent, as the child should be able to see and understand which activities he has carried out. To enhance this understanding for the child, you can use the stickers or the stars as you see on the chart as a reinforcement by putting them next to the activity that the child completes. Do keep in mind that the child would take time and with repeated practice and trials would be able to complete the activity as is meant to in totality. However, for each activity that the child carries out, do reinforce by placing the star. For hand washing after the use of the toilet, ensure that the hand washing picture cards shown earlier are placed next to the sink to be in the child's visual range. The child should be able to have these close by in order to look at these and understand the sequence that he or she must follow for hand washing activity. Also ensure that paper napkins, towel or soap is placed next to the child for the comfort of reaching out easily. You can also place different items of the child's interest in the washroom, which can serve as further means for reinforcement. For example, any toys or games that the child enjoys, or reading books that the child may enjoy as well. You could also use the bubble blower as seen in our video, which helps the child enjoy the toilet training activity through a distraction in a fun and engaging manner by blowing off the bubbles. Place the Velcro board with the picture cue cards and the activity chart at the eye level of the child. You can start by removing the picture cue cards for each step and placing on the chart to help the child understand what must be done, and reinforcing by placing a star or sticker next to it. You can use the hand on hand technique to help the child gradually understand that he or she must remove the cards and carry out the activity. You can show the card and even say the instruction out loud. Do ensure that you carry this out on a daily basis for a period of 2 months for this to become a habit for the child. As the child understands how this must be carried out by placing the cards in the sequence of doing the activity in the washroom, you can gradually wean off using the picture cards and the chart once you realize that the child can carry this out on his or her own without additional support.